Welcome to the deep dive. Have you ever noticed maybe a subtle shift in your horse's eating habits? Perhaps a new fussiness or even a reluctance to take the bit. These quiet signs, they can often point to some hidden discomfort. Today, we're taking a really in-depth look at equine oral ulcers, those painful sores that can show up in a horse's mouth, sometimes without any obvious external clues. We've pulled together a pretty comprehensive collection of resources for this discussion. Everything from essential veterinary texts to some cutting-edge research. Our aim here is to really distill the most vital insights for you. We want to guide you through the surprising array of causes, the telltale symptoms you should never miss, and how vets actually diagnose and treat them. Think of this as your kind of go-to guide for understanding a common yet often quite complex issue that really impacts a horse's comfort and, well, their overall well-being. So to begin, what exactly is an oral ulcer in a horse? Where do these open sores typically show up? And, why is this something every horse owner or enthusiast should really understand?
Right. Well, an oral ulcer is basically a break, a disruption in the protective lining of the mouth. That lining is called the oral mucosa. Think of it like an open sore, really. They can develop almost anywhere inside on the lips, the gums, the tongue, inside the cheeks, even deeper, like in the throat area, the pharynx. And these ulcers, they're a significant source of pain. That pain directly impacts a horse's ability to eat comfortably, and it can even lead to noticeable behavioral changes. Our research indicates that these sores, they sometimes follow other lesions, like fluid-filled blisters, or they can simply result from a direct injury.
That makes perfect sense. Okay, so diving a bit deeper into why these ulcers form. Our sources, they reveal a surprisingly wide range of culprits. When you look at all the possibilities, what's the most common cause? The one that we, as horse people, should probably be aware of first.
Yeah, what's often overlooked but really critically important is just how frequently these issues stem from direct physical trauma, right there in the mouth. That's definitely the most common category. And the primary offenders, well, they're often related to dental health. First up, sharp dental points. If you imagine your horse's cheek teeth, the molars and premolars, they're constantly erupting and wearing down throughout their life. But because they don't wear perfectly evenly, sharp edges, or enamel points as we call them, can form. And these sharp points, they can easily cut and lacerate the soft tissues of the cheeks and the tongue. That leads directly to ulcers.
Ouch. Okay.
Then you have misaligned teeth, or malocclusions. When teeth don't line up correctly, it causes abnormal wear patterns, and again, that can lead to trauma to the soft mouth tissues.
Right.
Also, damaged teeth, things like broken teeth or infected tooth roots can create sharp, irritating edges or even inflammatory lesions that eventually turn into ulcers.
Okay.
And foreign objects, sometimes, things like splinters, maybe little wood fragments from chewing on fences, or sharp bits of plant material can get embedded. That causes very localized trauma and ulceration.
Yeah, I can see that happening.
Then there's bit-related issues. An ill-fitting bit, or even just rough handling, can cause painful ulcers. You see them on the bars of the mouth, the corners of the lips, sometimes even on the tongue itself.
Sure.
And believe it or not, self-inflicted trauma. In some situations, horses might accidentally bite their own tongues or cheeks. This happens especially if they're already in pain or maybe have neurological problems like facial paralysis. Studies show when things like facial paralysis or other dental issues are present, food can actually get trapped between the teeth and the cheek. That leads to constant rubbing and damage.
Wow.
And finally, even the feed. Ingesting really coarse stemmy hay or plants with sharp-ons, think things like foxtail or yellow star thistle grass, it can cause abrasions and erosions inside the mouth.
Wow. It's incredible how many ways a horse's mouth can just, encounter physical stress. But okay, beyond that direct injury, our research points to infections as another major category. What kind of infectious agents are we talking about here? And what makes them, particularly concerning?
Right. Infections are definitely another big piece of the puzzle. We see several types that can result in oral ulcers. First, viral infections. Equine herpes virus, that's EHV1 and EHV4, sometimes called equine viral rhinopneumonitis. It can cause oral ulcers as like part of a broader respiratory illness complex.
Okay.
But vesicular stomatitis virus, or VSV, that's a really key one to be aware of. It causes these fluid-filled blisters, vesicles that quickly rupture and form really painful ulcers on the tongue, lips, gums. What's crucial about VSV and concerning is that it's a zoonotic disease.
You meaning it can pass to humans?
Exactly. It can be transmitted to humans, and it can also affect the horse's ability to move, causing lesions on their hoof coronet bands and leading to lameness. So quite serious. Other viruses, like equine papillomavirus, can cause warts that might ulcerate if they get, traumatized or bumped.
Okay.
Then we have bacterial infections. A prime example is a bacterium called Actinobacillus linearese. It causes something called wooden tongue. This leads to these firm, kind of inflammatory lesions, often on the tongue, that can break down into ulcers. We also see ulcers forming from deep-seated infections or abscesses that are linked to teeth, where maybe pus might drain out into the mouth.
Right, a draining tract.
Precisely. And lastly, fungal infections. Something like candidiasis, which is a type of yeast infection, can cause these white plaques in the mouth that may ulcerate. This tends to be more common in horses that might have a compromised immune system, or maybe those on long-term antibiotic therapy.
It's truly fascinating, isn't it? How the body can react to such a diverse range of threats, both internal and external. What about outside irritants or toxins that a horse might ingest? This sounds like a particularly tricky set of causes to maybe pinpoint.
You're absolutely right. This category covers some very serious possibilities, and they can be challenging. Think about caustic substances. Horses can develop ulcers just from chewing on things like, say, chemically treated wood, old lead paint, or even certain strong disinfectants if they get access.
Mhm.
Then there's photosensitization. Some plants can actually make a horse's skin hypersensitive to sunlight. This can lead to severe, almost sunburn-like lesions on the non-pigmented areas, which often includes the lips and muzzle, and those lesions can then ulcerate.
Oh.
Aflatoxins. These come from moldy feed, particularly grains. If feed gets contaminated, these toxins can cause widespread systemic illness, and oral lesions can be part of that picture.
Right, moldy feet is always a worry.
Definitely. And then there's blister beetles. This is a particularly dangerous one. If horses accidentally ingest blister beetles, which are sometimes found in alfalfa hay, there's a toxin called cantharidin. This toxin causes severe irritation and ulceration basically all the way down the mouth lining, the esophagus, the entire digestive tract.
How does it do that?
Well, the mechanism involves damage to cell membranes, causing cells to actually separate, a process called a cantholysis, which leads to blister formation. And the effects of this cantharidin toxicosis, they go way beyond just the mouth. It causes severe colic, kidney damage, heart muscle damage, even a stiff gait. It's really nasty stuff.
That sounds truly awful.
It is. And then there's phenylbutazone toxicity, or bute toxicity. This is critical for owners to understand. Phenylbutazone, or bute, it's a very common anti-inflammatory drug. But if it's given in excessive doses, or maybe accidentally in large amounts over several days,
Right.
it works by inhibiting prostaglandins. And the depletion of certain prostaglandins, PGE1 and PGE2, is thought to cause vasoconstriction, narrowing of the tiny blood vessels in the lining of the mouth and gut. This leads to ischemia, lack of blood flow, and then ulcer formation.
So it's not just the mouth then?
No, not at all. The effects aren't limited to the mouth. We see severe ulcers in the stomach and intestines, particularly a condition called right dorsal colitis. And it can also damage the kidneys, causing something called renal medullary crest necrosis. Other signs owners might see include fluid swelling under the belly and legs, ventral edema plus teeth grinding, diarrhea, and those dark, tarry stools from internal bleeding called melena.
Wow, that's a lot from a common medication.
It really underscores the importance of correct dosage. And our research also flags certain wood shavings used for bedding, specifically from plants in the Cimerabaceae family, as another potential chemical irritant.
Okay, so it's not just external forces or infections. You also mentioned the body's own immune system, or maybe even something more ominous, like a serious underlying illness.
Absolutely. While these might be less common overall, these categories are just as vital to recognize. We have immune-mediated and inflammatory conditions. This bucket includes autoimmune diseases like pemphigus. That's where the body's own immune system mistakenly attacks its skin and mucous membranes, causing blistering and ulceration. Eosinophilic granulomas are another example. These are reactive inflammatory lesions, almost like proud flesh, that can appear in the mouth as firm, non-healing ulcers. Stomatitis is really just a general term for inflammation of the oral lining. And there's also something called equine ulcerative stomatitis, which looks a bit like vesicular stomatitis, but the cause is actually unknown. And another condition is equine exfoliative eosinophilic dermatitis.
Okay, and the more serious possibility.
Neoplasia or cancer. Oral tumors can definitely manifest as ulcers that just won't heal. Squamous cell carcinoma, or SCC, is the most common type of oral cancer in horses. It might look like a proliferative kind of cauliflower-like growth, or sometimes just a persistent ulcerative lesion.
Right.
Sarcoids, which are a type of skin tumor, can also occur in the mouth. They often present as locally aggressive, non-healing ulcers, even melanomas. While they're typically benign in gray horses, they can ulcerate if they get traumatized, or sometimes they can become malignant.
Hmm.
And then there are other less common tumors like fibrosarcomas that can also cause oral ulcers.
Okay.
Then nutritional deficiencies. Now, this is less common today with modern horse management, but severe deficiencies in certain vitamins, like vitamin A or the B complex vitamins, can weaken the mouth's lining, making it more susceptible to ulceration.
That makes sense.
And finally, uremia. This is a really interesting systemic cause. It happens when the kidneys aren't functioning properly. This leads to a buildup of waste products, especially urea, in the bloodstream. This excess urea then gets excreted into the horse's saliva.
Okay.
Bacteria that normally live in the mouth then break down this urea into ammonia. And ammonia is highly irritating. It literally disrupts the integrity of the oral lining, causing ulcers.
Wow, so the kidney problem directly causes mouth ulcers.
Directly. And if we step back and look at the bigger picture, uremia isn't just about mouth sores. It comes with a whole host of other serious signs. Things like significant weight loss, that's often the main complaint, increased urination and drinking, stomach ulcers, bleeding disorders due to coagulation problems, and a very distinct urine odor on the breath, halitosis. You might also see excessive dental tartar buildup and that ventral edema, the fluid swelling under the belly, due to various factors like low protein and leaky vessels. It truly affects multiple body systems, bone marrow, endocrine, central nervous system too.
Gosh, that really drives home how interconnected everything is.
Yeah.
So with such a huge list of potential causes, the challenge for any owner is, well, knowing when something's actually wrong. What are the key signs, the things you should really be looking for to suspect a horse might have an oral ulcer?
Right. The symptoms can definitely vary. It depends on the ulcer's size, its location, the number of ulcers, and of course the underlying cause. But oral pain is almost always the most consistent indicator. So here's what to look out for. First and foremost, signs of oral pain. This is paramount. You might see your horses reluctant to eat, or maybe they drop feed from their mouth while chewing. We call that quitting.
Quitting, right?
Yeah. Or they might eat very slowly, taking much longer than usual to finish meals. They might toss their head or shy away when you try to bridle them or even touch their mouth area. And they may rub their face on objects more than usual.
Okay, those are definite red flags.
Absolutely. Also, excessive salivation or taillism. This often appears as drooling or maybe a foamy discharge around the mouth. Bad breath, halitosis. This can be due to bacterial infection within the ulcer itself, or maybe food getting trapped in there. And remember, in specific cases like uremia, the halitosis will have that distinct urine odor. Weight loss. If the pain is severe enough that it significantly reduces their feed intake over a period of time, you might see blood, visible streaks of fresh blood, perhaps in their saliva or mixed in with their feed.
Okay.
Swelling. You might notice localized swelling of the jaw, the cheek, or the lip, particularly if the ulcer is quite extensive or if it's linked to an underlying abscess. And behavioral changes. Beyond just eating, you might see some general irritability, a new reluctance to accept the bit, or maybe resistance during routine dental exams.
That makes sense.
And finally, visible lesions. If you or your vet can actually get a look inside the mouth, ulcers appear as open sores. They often have a reddened, inflamed border and maybe a pale yellowish or grayish base. They can range quite a bit from small erosions to really large, deep defects.
It's a very clear picture of what to observe. Now, this raises an important question. Do these symptoms give us any hints about the specific underlying cause? Do they vary significantly enough to maybe point a vet in a certain direction early on?
They absolutely can, yes. The history you provide the vet, combined with their physical exam findings, these are crucial clues. For example, in vesicular stomatitis cases, it's often an outbreak situation, maybe affecting multiple animals on a property. Owners typically report a pretty sudden onset of excessive salivation, loss of appetite, and sometimes even lameness. And the key is those characteristic oral blisters appearing first, which then merge and turn into ulcers.
Okay.
With phenylbutazone toxicity, like we discussed, there's usually a history of too much bute being given, either too high a dose or for too long. And beyond the oral ulcers, you'd likely see other signs like that ventral edema, the teeth grinding, diarrhea often linked to that right dorsal colitis, the dark, tarry stools from GI bleeding, and weight loss.
Right, a whole cluster of signs.
Exactly. For cantharidin toxicosis from blister beetles, the picture is different again. You might observe a very depressed horse, recurrence, signs of colic, maybe a fever, profuse diarrhea, straining to urinate, possibly that distinctive thump sound in sync with the heartbeat's synchronous diaphragmatic flutter and a stiff gait.
Very specific signs there.
Yes. In uramia, the main thing an owner usually reports first is the increased urination and drinking, the PUPD. The oral ulcers are then found alongside all the other signs of uremic syndrome. We talk about the weight loss, stomach ulcers, bleeding issues, and that telltale urine odor on the breath.
Okay.
And in simpler cases, like physical trauma from coarse forage or plant-ons, you'd likely find evidence of those specific plants in the horse's pasture or maybe in their hay. Or if it's facial nerve paralysis, there would generally be a history of some kind of trauma or perhaps a broader central nervous system issue preceding the mouth problems.
So, okay, if you're suspecting an ulcer based on these signs, what's the diagnostic journey actually like for a vet? It sounds like it's definitely more involved than just a quick glance, given how complex the causes can be.
It's certainly a thorough process, yes. And a comprehensive oral examination is absolutely essential. This nearly always requires light sedation for the horse.
For safety and visibility.
Exactly. Safety for everyone, and to allow the use of a full mouth speculum. That speculum holds the mouth open so the vet can get complete, safe visualization and also palpation feeling of all the structures inside the mouth.
Makes sense.
The vet will start by taking a detailed clinical history from you. They'll ask about when the signs started, how they've progressed, any recent changes in feed, recent dental work, any medications given, or any other signs of illness.
Okay, gathering all the background.
Precisely. Then they'll do an external examination, feeling around the horse's head and jaw for any swelling, pain, or asymmetry, maybe checking for nasal discharge. But the core of it is the oral examination itself. With the horse sedated and the speculum in place, the vet uses a strong light source, often a headlamp, for really clear visualization. And digital palpation is key. That means systematically feeling all the soft tissues, the gums, cheeks, tongue, palate, and also the surfaces of the teeth. They're feeling for sharp points, any foreign bodies, or maybe masses.
So feeling is as important as seeing.
Absolutely. And then they'll directly observe all the mucosal surfaces, looking for those ulcers, any inflammation or growths. Sometimes an oral endoscope, which is a small camera on a flexible tube, can be incredibly helpful for seeing the very back regions of the mouth and the throat, areas that are hard to see otherwise.
Technology helps there.
It really does. A thorough dental examination is always part of this process too, specifically looking for those sharp enamel points, any fractured teeth, or signs of gum disease, periodontal disease.
Okay.
Now, for any ulcers that aren't healing as expected or look suspicious, a biopsy is crucial. The vet takes a small tissue sample from the ulcerated area and its margins and sends it to a lab for histopathology. This is vital to rule out neoplasia cancer or maybe identify specific inflammatory or infectious causes, like a fungal granuloma, perhaps.
Got it. Biopsy for the tricky ones.
Exactly. Imaging, like radiographs or x-rays, might be used if the vet suspects underlying dental disease, maybe bone involvement like osteomyelitis, a bone infection, or an underlying tumor invading the bone. And more advanced imaging, like computed tomography, CT scans, give incredibly detailed 3D views. That's especially useful for really complex dental issues or figuring out the extent of bone invasion by a tumor.
Right.
If a bacterial or fungal infection is suspected based on the appearance or history, a culture and sensitivity swab can be taken. That helps identify the specific bug and tells the vet which antibiotics or antifungals will be most effective.
Smart. Targeted treatment.
Yes. Blood work might also be useful. That's if the vet suspects a systemic illness or maybe nutritional deficiencies. A CBC, complete blood count, can check for inflammation or infection. Biochemistry panels assess organ function like kidney and liver values, and you can test for specific vitamin or mineral levels if needed. And finally, just to reiterate, if vesicular stomatitis virus, VSV, is on the list of possibilities based on the clinical signs and maybe an outbreak situation, then state veterinary authorities must be contacted immediately. Specific diagnostic samples, like fluid from the blisters or tissue, need to be collected for virus isolation or other specialized tests like ELISA.
That's a really important public health point.
Absolutely. And just to round that out, other specific diagnostic approaches we found in the sources include things like testing for cantharidin in stomach contents or urine if blister beetle toxicosis is suspected, or carefully reviewing the medication history if bute toxicity is a concern, or performing detailed kidney function tests blood urea and creatinine, kidney ultrasound, urinalysis, maybe even a kidney biopsy if chronic renal failure and uremia are suspected. And of course, simply examining the horse's environment closely to rule out trauma from those pasture-ons.
That truly highlights the detective work involved. What really stands out to you about how vets approach these diagnoses, given the sheer number of possibilities we've talked about?
Yeah, what consistently impresses me is the truly holistic approach vets take. It's really not just about looking at the mouth in isolation. It's about connecting what might seem like disparate symptoms, taking that deep dive into the horse's entire history, their environment, their diet, and assessing their overall systemic health to pinpoint that root cause. It's a fantastic example of holistic veterinary medicine in action, really. You have to look at the whole horse.
That's a great point. So once a diagnosis is actually made, what does the path to recovery look like for these ulcers? Is it usually just a simple topical treatment, or is it much more intricate considering that vast array of underlying causes we've discussed?
Right. The treatment is absolutely customized. It has to be tailored to the specific underlying cause that was diagnosed. The main goals are always, number one, resolve that primary problem. Number two, encourage the ulcer itself to heal. And number three, critically, alleviate the horse's pain.
Okay, so addressing the root cause first.
Always, that's the foundation. So, addressing the underlying cause. Dental correction is probably the most common treatment needed. This involves floating, rasping down those sharp enamel points, and addressing any malocclusions or fractured teeth. In some severe cases, diseased teeth might even need to be extracted. Foreign body removal, obviously, if something's embedded, it needs to be carefully removed. Infection control. This could mean systemic antibiotics given by injection or orally, or maybe topical antibiotics applied directly in the mouth for bacterial infections. Same goes for antifungals, systemic or topical for fungal infections. For viral causes, direct antiviral options are often limited in horses, so supportive care becomes really paramount. Specific antiseptic mouthwashes, like a dilute chlorhexidine solution, can help reduce the bacterial load in the mouth and promote healing regardless of the initial cause.
Okay, washes can help generally.
They can. For toxic exposures, the absolute first step is to remove the horse from the source of the toxin. Then supportive care is key things like activated charcoal given via stomach tube to help bind toxins remaining in the gut, or intravenous fluids to support hydration and kidney function. If it's neoplasia cancer, treatment options depend heavily on the tumor type and how advanced it is. It could involve surgical removal, injecting chemotherapy drugs directly into the tumor, radiation therapy, or cryotherapy, which is freezing the tissue.
Right, more complex options there.
Definitely. And for immune-mediated disease, those conditions often require systemic corticosteroids or other medications designed to suppress the overactive immune response.
Okay, so that covers tackling the cause. What about managing the immediate discomfort?
Right. Pain management is crucial for the horse's welfare and encouraging them to eat. NSAIDs, non-steroidal anti-inflammatory drugs, are commonly used. The main choices are usually flunixin meglumine, which most people know as Banamine, or phenylbutazone bute. These are given systemically, usually by injection or paste, to reduce pain and inflammation throughout the body.
Okay.
And sometimes topical analgesics might be used. These are sprays or gels containing local anesthetics like lidocaine or benzocaine. They can be applied cautiously, directly to the ulcer to provide temporary local pain relief, maybe especially right before feeding to encourage eating, but caution is needed with dosage and frequency.
Got it. And helping the ulcer actually heal.
Yes. Promoting healing and reducing irritation is the next step. A soft diet is really vital. Feeding soft, palatable feeds like soaked hay cubes or pellets, maybe gruels or mashes, helps minimize further trauma to the sore areas during chewing. You definitely want to avoid coarse hay or hard concentrates during the healing period.
Makes sense. Less rubbing.
Exactly. Oral rinses, like we mentioned, the antiseptic ones like dilute chlorhexidine, help reduce bacterial contamination. But even simple warm saltwater rinses can be very soothing and help keep the area clean. Some vets might also use topical protectants. These are special gels or pastes, for example, a sucralfate slurry that can coat the ulcer. It forms a kind of protective barrier over the sore spot, which can aid healing.
Like a bandage for the inside of the mouth.
Kind of, yeah. And if a nutritional deficiency was identified as a contributing factor, then appropriate vitamin supplementation is needed, things like B-complex vitamins or vitamin A.
Okay.
And finally, just general supportive care, making absolutely sure the horse has constant access to fresh water, especially if drinking is painful for them, and closely monitoring their weight to make sure they're maintaining good body condition throughout the treatment.
It's a really comprehensive approach. So looking ahead then, what does all this mean for the horse's future? What kind of prognosis, the likely outcome, can owners generally expect for these conditions?
Yeah, the prognosis for oral ulcers in horses is really highly variable. It almost entirely depends on that underlying cause that was diagnosed. For instance, it's generally excellent for most straightforward traumatic ulcers. Think about those ones caused simply by sharp enamel points.
Right, the most common ones.
Exactly. They typically heal very quickly and completely once the cause is addressed, like after a routine dental floating, usually within days to a week or two.
That's good news.
It is. The prognosis is also usually good for many mild infectious causes, provided they respond well to specific and targeted treatment, like the right antibiotic or antifungal.
Okay.
However, the prognosis can range from guarded to poor for the more challenging situations. This includes things like very large, deep, or chronic, long-standing ulcers. Ulcers that are associated with significant underlying systemic diseases like aggressive cancers, severe systemic infections that are hard to clear, extensive bone involvement, or those chronic immune-mediated conditions that are difficult to manage long-term.
Hmm.
Also, ulcers that occur in really difficult-to-reach locations like way back in the pharynx or at the base of the tongue. Definitive treatment or even ongoing management can be really challenging in those spots.
I can imagine.
And the prognosis is also more guarded in cases where there are severe complications, like maybe aspiration pneumonia, if the horse has difficulty swallowing due to the pain, or if there's widespread systemic disease, like with advanced uremia or uncontrolled cancer.
So it really runs the spectrum.
It absolutely does. But I think the key takeaway here, really the most important message, is that early recognition and prompt veterinary attention are absolutely essential. Diagnosing that underlying cause swiftly and initiating the appropriate treatment quickly, that often leads to a very favorable outcome for the vast majority of non-cancerous causes of oral ulcers.
That's a really important point. Early action makes a big difference.
Well, we've certainly covered a lot of ground today. I mean, everything from the really common problem of just a sharp tooth edge, all the way to complex viral infections and even those dangerous toxins like blister beetles or the serious implications of misusing common medications like bute.
Yeah, this discussion, I think, truly highlights just how interconnected a horse's health really is. What might seem like a relatively small issue isolated to the oral cavity can often be a crucial indicator, a signpost, for a much larger systemic problem happening elsewhere in the body. The mouth genuinely serves as such a vital window into a horse's overall well-being. You can learn a lot by looking in there. Indeed. So if there's one key takeaway our listeners can carry forward from this whole exploration, what would you say it is?
For me, it really comes back to the immense importance of keen observation. Just really knowing your horse, understanding their normal behavior, their normal eating habits, their daily routines, that allows you to spot those subtle changes, maybe in eating habits or just their general demeanor. Those are so often the earliest warning signs that something might be amiss.
I completely agree. That owner observation is invaluable.
So here's a final thought for everyone to consider, something to mull over. Given how many of these causes we discussed are tied directly to diet, or the horse's environment, or even routine care like dentistry, what proactive steps might you or other horse caregivers take to actually minimize the risk of these painful ulcers developing in the first place? Beyond just ensuring regular dental floating, what other preventative measures may be in feed selection or managing their turnout areas, their surroundings could potentially make the biggest difference in their daily comfort and perhaps prevent some of these issues from even starting.